Hello, everyone. Welcome to the third installment of my discussion with Doctors Bland, Jones, and Chastain regarding COVID-19 and infectious disease, frontline pharmacists doing their job across the state. In the last portion of our segment today, I'd like to talk about comorbid disease states. And this is really talking about how to manage those chronic medications and chronic diseases that people deal with every day that are beyond COVID-19, such as diabetes. So if you don't mind, we're going to get started with those discussions. We talked earlier about hydroxychloroquine and azithromycin. We talked about the vaccine. We've talked about sort of preventive drugs that are over the counter and herbals. But I'm actually getting questions left and right about other medications. Dr. Bland, I know you do a lot of primary care. You work with a great deal. What questions are you getting from the community when they know or find out you're a pharmacist? What are you hearing from people with regard to people taking their medications or even getting access to medication now that we're all kind of in this quarantine effort and staying home?
Yeah, that's a great question. I spent a lot of time and, I worked a lot in the community, been in practice 20 years. So as a pharmacist, once people figure out you're a pharmacist, they're trying to find who they can trust to get solid information, because literally the amount of press that's on this topic is, as a healthcare professional, it's pretty overwhelming to me. But then as a layperson, I can only imagine. A lot of the questions have centered around medications like ibuprofen or ACE inhibitors or angiotensin receptor blockers for blood pressure or heart failure, because there was some initial press questions on whether these may increase your risk for COVID acquisition. If you're on a chronic medication for really any reason, you should not stop that medication on your own, because there are a number of medications out there that if you stop them could increase your risk for being admitted to the hospital. Like let's take the ACE inhibitor, for example. So lisinopril, ramipril, Prentavil is a brand name. Altase is another one.
These are used for high blood pressure, but they're also used in heart failure. So people may be on them for multiple reasons, right?
Absolutely. If it ends in pril or it ends in sartan, those are the ones that have been kind of in the news. And so if you stop those medications and you have heart failure, those are drugs that we use in people to keep them out of the hospital and to keep them from dying. Another important drug class are what are called the DOACs, or the anticoagulant, drugs like Eliquis or Xarelto, and drugs that have a black box warning that if you stop them abruptly, it may increase your risk for a clot, a stroke or a heart attack. Mm-hmm. So I talked with my mother-in-law this weekend. She was actually going to stop her blood thinner because, again, kind of getting back to patients, they have certain sets of assumptions that they have about what's going to happen. And so she normally has to go in physically into her physician's doctor's office for refills. And so she said, well, I didn't want to go in there. I'm scared. I'm higher risk. I don't want to get COVID-19. So I was just, go ahead.
You didn't want to sit in the waiting room with everyone.
Yeah, which makes sense, right? Common sense. But what she said was, well, I just figured he wasn't going to give me a refill. So I have about 5 days left and I was just going to make it work. And I didn't know exactly what that meant. But I quickly told her that, hey, we are not in normal times. Here's some things for patients. Number one, don't stop anything abruptly. Number two, don't half your medication. That was something else I heard this weekend, where somebody says, well, I'm on 100 micrograms a day of Synthroid, a very common drug. I'll just take 50 micrograms and make it last longer until this pandemic is over, right? So not adjusting a dose, not stopping anything, those can make for side effects and eventually potentially a hospital admission. And the last place you want to be right now is being admitted to the hospital, where they are caring for a lot of COVID-19 patients, potentially, depending on where you are. And that would increase your risk for exposure to the virus. So there are a lot of things that can happen due to misunderstanding. So here's a couple things I'd like to point out. One, quickly, pharmacists within Georgia have the right under the governor's edict now that they can refill any chronic medication for 90-day supply if they cannot contact the provider. Now, obviously, the first thing you want to do is contact the provider. But even if they can't, they have the authority to do a 90-day extension, essentially a 90-day refill. Now, insurance companies may not pay for 90 days, but they will pay for 30, and you still would have those other refills down the line. And the other thing is most primary care offices are doing a lot of telehealth now. Kind of like we're talking now on this interview. We would never do this interview in the same office, right? To try to educate our public. So they will do a telehealth visit like this, make sure everything's okay, ask a few questions, and then they call in the refill. So there's a lot of different ways to accomplish the same goal, and that is not to stop these chronic medications. The American Heart Association, the Rheumatologic Organization, all of these have all said, please do not stop these medications.
So, I mean, in talking about these, I think it's important for everyone to realize that if you're discussing your medications, you're looking short, contact your primary care provider, whomever that should be, and talk your way through that. As we come to an end, gentlemen, you know, each of you are busy. I don't want to hold you more than I have to. You have to get back out there and care for the patients. But I want you, if you could, to sort of give me at least one pearl that we want our community here from pharmacists on the front line, things that you would tell your own family members to keep them safe or to sort of keep them out of harm's way. I'll start with Dr. Chastain. What pearl would you give our community, sir?
I think the biggest thing is try to stay away from other people as much as possible. Even in the setting of a negative test, it does not necessarily mean that you are negative. I mean, the only way to decrease the spread from one person to another is to try to avoid those individuals. We can curb the increase, because with the increase you see greater utilization of prescribers and nurses and pharmacists and PPE, personal protective equipment. And so if we can hopefully curb it, then we can get ahead of this thing and maybe make some impact going forward.
It's a good thought and also a good reminder. Dr. Jones, what would you leave us with?
You know, I think there are a lot of people out there that are going to tell you different ways to try and prevent this, different ways to treat this. The two interventions we know work are social distancing and hand washing. I do want to remember that. And also, you know, from the front lines here, the thing that we as healthcare professionals want the public to know is that whether it's physicians, pharmacists, the nurses, the respiratory therapists, and everybody else, that, you know, we are out there every day. We're doing the best we can, and we're all working as part of a team, which is really the way we're going to solve this.
It's a good point. I think many people don't realize that healthcare is a team sport, that it's physicians, nurses, pharmacists, EMTs, respiratory therapists, and a whole host of other folks within the institution that really support and make sure this happens. My hats are off to you guys. And Dr. Bland, what would you leave the community with?
I would say, you know, right now, a lot of what I see is unfortunately either people just thinking this is a hoax or nothing to worry about, and then the other side is just pure panic. And what I would say is really what we need to do is be in the middle, and that is to do the things that Dr. Chastain and Dr. Jones have talked about, and understanding that if you do get symptoms consistent with it, the CDC has a great webpage that what to do if I think I'm sick with COVID-19. The vast majority of patients that get the illness do just fine. 80% of these are mild, but it's for that 20% that we, you know, may have respiratory symptoms that would need to get further care. And so what I would say is be vigilant, love your neighbor, you know, stay away from them, you know, say hey to them from a distance. We'll get through this, but it's important for us to take it seriously and really trust the healthcare providers that are in our path to be able to get good, solid information.
Thank you, gentlemen. That concludes our three-part series talking with infectious disease pharmacists across the state of Georgia. We've summed up social distancing. We've summed up therapeutic modalities or drugs we're using to fight COVID-19, as well as how to stay healthy with other disease states and your chronic medications. These gentlemen have spent a great deal of time with us, and I want to say thank you once again to them. Also, as a teaser, please keep in mind that community is actually coming to the forefront of PharmCast. PharmCast will now have a community-based series ongoing, even with COVID-19 and other issues. Our next segment would be dealing with Dr. Scott Pagan, who actually is the Director of Drug Development at the University of Georgia. He's going to talk about vaccines, why certain drugs work and some don't, and what it looks like for the future with regard to what's in the pipeline. Thank you, everyone, for joining us. And again, thank you to the guests today, Drs. Bland, Jones, and Chastain, all amazing and doing their jobs as frontline pharmacists against this pandemic.